is SiriusXM Dr. Radio.
And now, from the heart of the NYU Langone Medical Center, this is Dr. Radio Reports, Coronavirus. What you need to know now. Here is your host, Dr. Mark Siegel.
Welcome back to Dr. Radio Reports, COVID-19, coronavirus, what you need to know right now. I'm Dr. Mark Siegel, Medical Director of Dr. Radio, Professor of Medicine, NYU Langone Health, author of books on pandemics. A reissue of my book, False Alarm, Truth About the Epidemic of Fear, is going to be COVID-centric. COVID-centric, that's pretty interesting. And I want you to give us a call if you have questions about fear, about anxiety, about the effects of COVID on the psyche and on the brain, because we have an amazing guest with us for the first half hour. I wish he was longer. I'm going to invite him back next week probably. Dr. Jeffrey Lieberman, who, believe it or not, I actually know for a long time. I'm not supposed to know him, but I do. He's the chairman of psychiatry at NYU Presbyterian Columbia University Medical Center. He's the psychiatrist in chief at New York Presbyterian Hospital, Columbia University Medical Center. He's the past president of the American Psychiatric Association. He's the host of Shrink Speak, love that name, podcast. Website, www.jeffreyliebermanmd.com. Dr. Lieberman, welcome to Dr. Radio Reports.
Thanks, Mark. Nice to be with you again.
So tell me, what is going on, just to start with a small question, to the American psyche?
It's not good. You know, this is the big one, Mark. We've gone through disasters in the past. We have flashbulb memories about things like when Kennedy was assassinated, when 9/11 occurred, Hurricane Sandy. But those were geographically limited and time limited. This is pervasive and is continuing for not just weeks and months, but possibly years. And in the aftermath of the COVID contagion, when we have a vaccine, when we have herd immunity, there is going to be continued sequelae from the economic and social disruption that are occurring. This is going to be something in which there's a generational effect. And while it's occurring to the whole population, including people of all age groups, probably among the most profound effects are going to be on the children.
You know, it occurred to me as you were talking that maybe I'll go against, I'll be a little heretical for a minute here and go against my own thinking. I'm always talking about vaccines, and I kind of am aware that on some level we're talking about hope against fear here too, even with vaccines. I mean, look, we don't know if we're going to have a vaccine, but we want to pin our hopes on something concrete. So what I'm getting at is, how will the American psyche be affected? And I'm unpacking your sentence, Jeff, because maybe how does it be effective if we never get a vaccine, or if the vaccine is years off, or if the vaccine isn't as effective as we are pinning our hopes on? How much more damage occurs then?
Well, substantial. I mean, we don't want to be Chicken Little saying the sky is falling and crying wolf. If, you know, there's not going to be as serious a consequence as we're forecasting. But I don't think we are in this case. This is, as I say, the big one. It's the black swan from the standpoint of disasters affecting public health. And here's why. You know, the effects of this are one that started out with, am I going to get sick, and how do I protect myself? And then it extended to a point of having to grieve the loss of loved ones who got sick and died. But then it's extending into an event that is disrupting our society and our way of life. And in the context of that, it's also affecting the way people earn their livelihood and how they can conduct their lives socially, professionally, recreationally. And it's not going to settle out into the normal again. And when it does settle out into the normal again, it's not going to be the old normal. It's going to be the new normal. So you can think of it like the Great Depression or World War II or even 9/11, that after these events occurred, life was never the same again. And that's what's taking place in our society. But because we're so caught up by having been taken unaware, caught sleeping or unprepared with this pandemic, we're not able to forward think and look into the future and try and plan for where things are going to be and how to position ourselves. We're still trying to contain the virus. And for that reason, I think that, the government leads us and has the convening authority and the legislative authority, but it's the medicine and the science that are the true arbiters of truth and reality now. And not to trumpet our own profession, Mark, but medicine and science is the most important religion we can all follow.
I want to go again a little bit more heretical than I usually go and challenge something. Not any of your contentions, but I want to challenge the reality
Please.
Okay, so not you. I'm not
to be wrong.
I'm pushing against the narrative, not your views. Here's what I want to say. You brought up 9/11, and after 9/11, I wrote hundreds of articles and ultimately a book about the following idea, and I want to see if you could apply it now or whether it's irrelevant. Here was the idea. 2 buildings were attacked, and we declared that the country was on a wartime footing, and everybody felt the American psyche was punctured, and 3,000 people died, and millions were affected. And I felt that there was a cold wind blowing through our society, and we were susceptible to every health scare after that, and we didn't feel the same. And we made comparisons to Pearl Harbor, and we made comparisons to World War II, and now here we are in a situation where our entire lives have changed. Now, that was a one-time event, but it clearly had huge implications. Our entire lives have changed, and everybody hopefully is wearing a mask, and people are social distancing. So people are either in compliance or denial, generally, not both. They're either in compliance or denial. The whole world has gone upside down. This country, tremendous changes. Again, either compliance or denial, usually not both. And we're looking at a disease which is probably infected, let's say 10 million people, let's say 20 million people, and let's say that it's killed 150,000, which is a huge number, and let's say that it ends up, I don't know where it's going to end up, but those are prodigious numbers. But, on the other hand, heart disease kills 700,000 people a year. And we don't even think about it. We don't even think that we're going to be upended by heart disease, though, by the way, heart attacks do upend people. I mean, they upend entire families. But we're not living with a conscious awareness of heart disease or cancer the way that we're living with the awareness of the threat here. Is that a fair statement? And if it is, how do you respond to it?
Mark, you want to know something? You're too smart. If our audience, I don't mean to be condescending, if our audience is a lay audience, we're going to be talking above them. If it's a more sophisticated audience, what you've done is to open a very perceptive and critical, granular understanding of historically how we should be thinking about this. And I completely agree, and I congratulate you on that insight. So you're right. What we're going through now is not a historical anomaly. This is not like a meteor crashes into the Earth. This is not aliens land from Mars. This is not the end of the world. This is not qualitatively different than 9/11. It's quantitatively different than 9/11. So 9/11 occurred, and everybody said, "Oh, Manhattan and New York City is gone. Nobody's going to live here anymore. They're going to live, and nobody's going to travel on airplanes anymore." And then a year later, people were back traveling. 2 years later, the real estate market and the economy were coming back in also. And so people got over it because human beings are resilient. Society is resilient, and there's progress through science and research. But this is quantitatively different, and here's why. After 9/11, we now had security in airports. We had much more terrorism. We had launched wars in the Middle East. These had major effects on us, but they didn't fundamentally affect every aspect of American life. Now we're going through something that for months and possibly a couple of years, we're going to have a disruption to the way we live, and in some of these instances, it will be permanent. So commercial real estate, what's going to happen to that now that we can telecommute just as effectively? The hospitality industry, the travel industry, the entertainment industry. These are suffering massive financial consequences, not to mention the fact that the United States is having to pump trillions of dollars into the economy to try and sustain it. What is that going to do to our debt? I don't know. And listen, maybe my statement of warning, which is being done in a way of crisis level and we need to really pull out all stops, is an overstatement. And if I'm wrong, I will be happy. But I don't see any downside to being wrong. In other words, if I'm wrong, nothing we've done to prepare for what is the imminent changes that I see looming in the future is going to be detrimental. The first step, it's like a three-act play. The first step is getting our arms around the contagion. The second act is trying to reactivate our way of life and normalize and our economy. And the third step is the post-COVID reality. And we're in the early stage of the second step, if that.
You know, what you just said is very profound, Jeff. I want to see if I understand it. Are you saying that if, and this is going to be a deliberate overstatement, I deliberately understated before, but here's the overstatement. Let's take it back to World War II. Are you saying that if people during World War II living in the United States, or let's say living in Europe even, if they understood what they were dealing with, then the adjustment was more doable or less severe than if somebody was in total denial? Is adjusting to the new reality and then a post-COVID reality?
Well, I don't know that my New York World War II analogy was the best, but I guess I would say is people knew Hitler was going to be as bad as he was. They wouldn't have let it get to the point where England had to stand alone for the Battle of Britain before the United States joined the war and after France had surrendered.
Hey, Jeff, don't kid yourself. We joined the war because of Pearl Harbor. Forget about the Battle of Britain. We would have left them there. We didn't care about it. We cared about Hawaii being attacked.
Well, then it would have been worse. You're right. Exactly. Then it would have been worse. But, you know, let me take it in another direction, Mark, which, you know, you and I will be able to relate to because we're of the same age. When we were in medical school and we were trying to figure out what specialty we should go into, and I remember thinking that infectious disease was a big specialty at that point because we had vaccines, we had antibiotics. So this is in the 1970s, mid-1970s. And at that time, we thought we had really, just like cardiovascular disease has now made so much progress with statins and with bypass and stents and everything that you guys do. But then we had, at the end of the 1970s, AIDS, okay? Then we had H1N1, swine flu, COVID, Zika, Ebola, and then COVID. Now, these were infectious pathogens, and they came, the reason why they were so notorious and frightening was because they were novel to the human species. They jumped from lower mammalian forms to humans, and they got out. Now, all of these came from either Africa or China, sub-Saharan Africa or central China, because of dietary, nutritional, lifestyle-related practices. In centuries past, these never got out because geography, there was no globalization. There was no, people were much more localized and segregated to their local environments. But with globalization, people could travel, and immediately what happened one place was a threat to everywhere. We globalized commerce, we globalized finance, we globalized travel, we globalized entertainment. We haven't globalized health. And we should have been aware that where's the World Health Organization? Where's the World Bank? Where's the UN? We should have seen this coming.
It's an interesting point you're making now. Let me see if I can direct this a little. You're saying that the novelty of this and the lack of preparation and psychological awareness is leading to what? Is leading to what? And I keep saying the American psyche. Obviously, I mean on a person-by-person basis. What's it doing to us that this swept over us? I can tell you in New York what you and I are dealing with. I mean, you must have very good personal experiences of how the sweep of this, the sudden onslaught of it, had an enormous psychological impact, right, at Columbia.
It's just beginning. It's just beginning. I mean, we haven't seen the full effect of it. So, you obviously are aware of the tragedy with my colleague, Lorena Breen, who committed suicide, this emergency room director who was a tower of strength, widely respected, never missed a day of work in her 15 years at Columbia, and she committed suicide in the midst of this. She was just overwhelmed by the magnitude of this. It wasn't anything qualitatively different than she had ever seen. It was just that it was so massive and she felt so helpless. And so when you talk about the American psyche is being assaulted in several ways. So one way, and that hasn't been really mentioned at all, is most people thought this was impossible. This couldn't occur, that the government and medicine and science would protect us. There couldn't be this is apocalyptic. This is medieval. This is something out of the Bible, where you have these kinds of events occurring. This is not something that we associate with the 21st century, and it's happening. Secondly, we're having something which is thankfully not as lethal as Ebola, but even if you think it's the mumps or the measles or the chickenpox, everybody's getting it all at once, as opposed to just when they're born and over time. And then third, it's had this effect in our society. So people feel like their confidence in the parental figures in our society, government, the doctor, the religious community, the leadership is helpless in the face of this vicissitude that has occurred. And they thought it couldn't happen, and it's happening. So it creates a climate of fear, and then people have to calibrate on an individual level. How do they keep themselves safe? How do they keep making money? How do they keep their families supported? How do they get their kids educated? What do they do about their elderly parents? And this is going to go on. And as you know, people are very resilient and can take a lot, but everybody has their breaking points, and we're going to see that occurring over the next few years. So I guess, I could say for me in psychiatry, we're going to have no shortage of business, but that's not a good thing.
You're listening to Dr. Radio Reports, COVID-19, the pandemic, what you need to know right now. I'm Dr. Mark Siegel, Medical Director of Dr. Radio. I'm a professor of medicine at NYU Langone Health. Great pleasure to be joined by a friend of mine, Dr. Jeffrey Lieberman, who I've known for many years. I met him on TV, I think, initially, but he's such a solid voice. And in this time, he's a great psychiatrist. He's the chairman of psychiatry at Columbia University Medical Center, New York Presbyterian, psychiatrist-in-chief at New York Presbyterian Hospital, Columbia University, past president of the American Psychiatric Association, host of Shrink Speak podcast. Jeff, you're really talking. Give us a call if you have a question about anxiety, about how you're going to cope with this crisis, about how Dr. Lieberman can help you. Give us a call at 1-877-698-3627. That's 1-877-698-3627, or email us at docs@SiriusXM.com. You just mentioned something that I'm really fascinated by, Jeff, the fear of the worst-case scenario. You're walking along. Do people try to comfort themselves by saying, well, I'm not in a high-risk group. Well, I'm not over 70 years old. Well, I'm not obese and don't have diabetes. What is it that gets people through the day? Because I think it's the fear. And even Dr. Sturman, who's a co-host of this show with me, said when he got COVID-19, and he's, I think he's in his 50s, but he was on the wards, he's our head of pulmonology. He was saying, look, I got COVID-19. I didn't know what the long-term consequences are going to be. I didn't know what was going to happen to my lungs, and he's a lung specialist. So are those fears based on not knowing, and then how do we reassure ourselves in the midst of it?
Well, there's good guidance on how to sort of manage and cope with COVID, and it's kind of mental health first aid. So the first thing is to, the expression to name it is to tame it. We've got to understand the nature of the threat. So we have a very virulent and contagious pathogen, but it's not 100% lethal, and most people recover from it. But on the other hand, it does have a mortality rate. If you go and look at the statistics, though, and you'll see that there is the lethality is concentrated predominantly in high-risk individuals who have immune suppressant from chemotherapy, or they have pre-existing conditions, respiratory, cardiovascular, diabetes. So it's concentrated there. Yes, we have some young people who have kind of rapid, severe cases and die. Yes, we have this pediatric form of Kawasaki-like syndrome of multisystem inflammatory, but this is not highly prevalent. The media has brought it to public attention, understandably, but most people don't get it. So the first thing is this is bad, but just because you get it, it's not going to kill you. Secondly, don't catastrophize. Third, sorry, Mark, don't watch cable news 24/7.
I'm the voice of reason. I'm the voice of reason.
Well, watch Dr. Mark Siegel on Fox. Don't watch everything else.
Listen,
and then you have to realize that this is not a snow day where you veg out on the couch while you're at home telecommuting. You have to put structure into your life by taking charge of how you're going to manage your time so that you're not at the mercy of the pandemic, so you can cope with it. But the other thing, Mark, and then I'll stop, is if you have a pre-existing condition of anxiety, depression, substance abuse, phobic disorders, obsessive compulsive, you're going to need more treatment, and you should reach out to your doctor or therapist. And if you don't if they say to you, I can't talk to you on the phone, I can't use Zoom, or I can't use FaceTime, get another doctor, because everybody has to be using it now.
You started getting at the answer to my next question, which is our program director, Beth Amin, has a great question, which is how is the mental health system going to stretch to handle the increased demand right now because of COVID fears?
Wow. Well, Mark, that's a great question. And I wish I could tell you that I knew the answer and we were doing it, because we're not. You know, the great hockey player Wayne Gretzky was asked one time, why is it you're so much better than everybody? What makes you so good? And he goes, when I was young, my father said, don't skate to the puck, skate to where the puck's going to be. And we're not looking to where the puck's going to be for this. But by coincidence, Mark, just this morning I was on a Zoom conference with some of the congressional leaders of northern Manhattan in preparation for a meeting we're going to have with the mayor next Tuesday. Exactly this. In other words, knowing that the front lines now are fighting the battle of COVID, stopping the infection, containing it, getting treatments, getting a vaccine. The next battle is going to be on the neuropsychiatric domain. And we've been trying to anticipate what that's going to look like and need, and developing a population mental health-based program for a defined catchment area, which is scalable. And it involves doing things that are beyond just bricks and mortar infrastructure, clinics, in-person visits. It has to do with things that are way beyond that. A community mental health core, using learning modules and teaching aids that are posted on specific websites, and leveraging the primary care system as a vehicle for administering mental health care. So there needs to be an anticipation of what's looming and a development or adoption of a plan that goes beyond what the traditional scope and reach of mental health care was. We can do it, but we haven't been doing it. And I hope we just don't miss this opportunity to at least limit the damage.
Let's go to the phones. Kevin in California, welcome to Dr. Radio Reports. What's your question to our expert psychiatrist, Dr. Lieberman?
Hi, this is Kevin. Thanks for taking my call. I'm an ER doctor here, and in the COVID crisis, I'm seeing a lot more anxiety attacks, panic attacks coming into the ER because of the COVID crisis. Now, the ERs are very busy to begin with anyway. I was just wondering, what's the best strategy, the best way to sort of take care of these patients with panic attacks or anxiety in the ER setting, knowing that, you know, time is of essence and there's not a lot of time in the ER setting. Thank you.
Well, I would triage. If the triage nurse or PA or whomever can determine that they don't have an acute medical problem, but it's mainly psychiatric, then you don't even have to bring them to the ER. You can triage them to a urgent care setting or a psych ED. And then for anxiety, you can manage the acute anxiety either by putting them in a calm environment temporarily to see if that dissipates their panic, or to administer a benzodiazepine. A benzodiazepine like clonazepam will be acutely effective if they have a pre-existing condition, meaning they've had a history of social anxiety disorder or panic disorder. Then they probably should be on a serotonin reuptake inhibitor, which will be effective, but it won't be effective acutely because it takes 7 to 14 days to work. But those would be the best initial remedies. And also, they should be connected to some ongoing mental health care so that they have a lifeline in the event of a recurrence of their panic attacks, as opposed to having to run to the emergency room.
Thank you for your call. By the way, Jeff, I'm assuming that you've got to be very careful about benzos in those patients in the hospital who are not yet on ventilators, because you don't want to suppress breathing, right? So that may change.
No, but these are not COVID-positive patients.
Okay.
These are people that come in for anxiety because of COVID. But you're right. If you're doing a psych consult on somebody who's a COVID patient in the ICU, which we have to do a lot, because one of the complications of it we've learned is there's a lot of CNS effects, particularly deliriums, and thromboembolic events that are causing TIAs.
Jeff, we don't really have time to take the next caller, but I like his question, so I want to pose it to you. What do you say to vaccine naysayers, whether from fear or from being anti-vaxxers? This is really important, and I actually, as you know, brought this question up to a very high place the other day. I'm really concerned about this. Studies say that 30% of our population say they ain't taking this vaccine. How are we going to handle this?
I think I'd say wake up. And look, you're entitled to your own opinions, but you're not entitled to your own facts. There's no factual basis to be anti-vaccine. And if you want to not take it, that's your right, I guess. And this is a question that I think we're going to be answering, or forced to answer, Mark, in the very near future. So every year when there's a seasonal influenza vaccine, I'm guessing that NYU recommends strongly that all of its faculty and staff take it, but they don't make it mandatory. Is that right?
No, well, you're getting into something that's extremely important at NYU, because Dr. Elizabeth Cohen, Dr. Grossman's wife, is a world-renowned ophthalmologist who was unable to operate. You may know this story because she ended up with zoster of the eye, and she is such a big proponent of vaccines that a lot of our vaccines are mandatory here, and I suspect the COVID vaccine will be too among our healthcare workers. I can't say that, but that's something we take incredibly seriously here. We have protocols for it. At Columbia?
Good for you. Good for you. No, at Columbia, it wasn't mandatory, but this year it is going to be mandatory. And what I would say to government officials, it should be mandatory for the public, because if people don't get it and walk around and are carriers, just like if you have tuberculosis, you're required by law to finish your course of treatment. If you have sexually transmitted diseases, there are certain things that public health overrides individual choice, and this should be one of them.
Final thoughts, Jeff, before we go to break?
I think that we're now responding. The medical profession and the healthcare system is responding to the needs of how to wrestle this virus to the ground. The problem is that it's not being done uniformly and systematically, and we need government leadership. Right now, New York is the safest place in the country to be, and that's because we went through this. We know what to do, and our governor is sticking with the discipline plan. So this is the first thing. The next thing is we should be thinking about where the puck's going to be. And I'm saying, Mark, it's going to shift from your territory of internal medicine to my territory, which is neuropsychiatric conditions.
I want to thank someone who I'm very confident in handling the puck, Dr. Jeffrey Lieberman, chairman of psychiatry at NYU Columbia Presbyterian Medical Center, a really world-renowned psychiatrist, neuropsychiatrist. Jeff, I'd love to have you back. Thank you for joining us.
Anytime, Mark. Take care.